Hey, so we're going to be doing our cross-fibering recipe on the neck, focusing on muscles mostly, of course, that are attached onto the cervical vertebrae. So our first move, or rather maybe we can start by saying our client's going to be face up for this recipe. The first move that we're going to do today is actually going to focus on the upper trapezius, remembering that the origin of upper trap is kind of in the center line behind the neck, starting at the top of the head and going down the spinous processes of the spine. We're actually going to mostly focus on the insertion points of upper trapezius. So the first one we're going to focus on today is going to be the insertion on the spine of the scapula. I'm going to take my bow stance and face it down the table over the side of the shoulder that I'm working on. I'm going to slide my hand underneath their shoulder. I'm going to try to place my palm, or rather I should say the back of my hand, solidly on the table, so that way I can lift my fingers this way. It's much less stress on your shoulder than trying to do anything like this. So when you do this move, try to let your hand rest on the table. Use your fingers to feel for the spine of the scapula. Stay just superior, and then use your stance. Notice here, my arm is very relaxed. It's just my wrist and fingers that are lightly lifted. And again, my hand and arm aren't doing the movement, my body is. So cross-fibering here at the spine of the scapula, thinking about the upper trapezius. And once we've done that, we're going to go ahead and switch our stance. I'm going to take the bow stance looking up the table. Our next insertion point is going to be on the acromion of the scapula. We're going to go ahead and come just medial, a little closer to the trapezius. That'll put us on the trap and not the deltoid. And we're going to cross fiber here using our bow stance. We're just going to create a very light bounce, using our fingers to lightly hook and pull into that muscle. So that's our cross fiber at the acromion. Last thing we're going to do is come out to the lateral clavicle. Go just behind the clavicle, hook into the soft tissues here of the trapezius, and we're going to cross fiber this third insertion point for the trapezius. All right, once we've gotten the trapezius kind of worked and ready, we should be able to get a little bit better access to the neck. So the next move we're going to do is going to be focusing on the neck. We're going to come down onto the sides of the table. And we are going to feel, again, for the transverse processes of the spine here. So you want to ask yourself to feel for the part of the bone that's closest to the surface of the skin. I say it's a shallow spot. So you can kind of see here, I'm looking, here's too far forward, here's too far back, but right about here is where it's nice and shallow. So I'm going to take that spot, I'm going to do light circles. And just kind of lightly almost like you're on the beach with your feet near the waves and you shift your feet and you can kind of sink into the sand. We're just going to lightly create circles here, asking for the tissues to lightly soften and to allow us to sink more deeply into the tissues. And I'm walking from C7 up to C6 and C5, up to C4. And we're going to walk all the way up the neck. Technically, you could go from the top down. There's really nothing that says you have to go one direction or the other in this case. So you can definitely work from C1 and go down to C7, or from C7 and go up to C1. Okay, once we've done circles on each of the transverse processes of the spine here, the next move that we're going to be doing is a shift. Now, when we do this shift, we're going to be thinking about pushing the spine first one way laterally and then the other way laterally. So we're going to use our fingers to lock onto the transverse process, and we're going to push the neck. We want to create a gentle but firm pressure that actually makes their neck move. We want to feel like we're pushing that bone just a little out of place, stretching it to the side, then let it fall back into neutral, and then use the other hand to create the opposite pressure. Think of it almost like a stretch. You don't want to bounce into it. You want to be sensitive to your pressure, and you want to give it time to release. Good. And then once you're done with that, move to the next one. Again, you can go from C7 up to C1 or from C1 down to C7. Remember that C1 itself is almost always difficult to reach, if it's even possible. Many people have that C1 buried under thick, tough fascia. So C2 to C7 are probably the easier targets. So again, going in, pressing, holding the pressure like a stretch, gently releasing into the neutral, and then doing the opposite push. And working our way up the spine. I'm going to start to speed this up, but you should take the time to work with your client. Be patient with this move. Okay, and all the way to the very top. All right, once we've done that, we're going to address levator scapula once more in the supine posture. In this particular case, usually what I'll do is I'll come in and I'll be looking kind of down, or rather just across the table with a very light downward turn. I'm going to feel for the transverse processes. I'm going to lock my elbow for myself. You may or may not have to do that. I'm going to feel for the transverse processes, and I'm going to go just behind them, just posterior. I'm going to create a light cross fiber on the levator scapula, thinking about C1, C2, C3, C4, transverse processes. And once I've made contact with those, I'm going to go ahead and drop down onto the belly. Remember, it's deep to trapezius. And what I'm going to do is I'm going to turn my stance now that I'm going towards the insertion. I'm going to feel for the shape of the scapula. I'm going to look for the superior angle. Once again, I'm going to press the back of my hand onto the table. I'm going to pop my fingers up like I'm doing this gesturing kind of movement. Once I have my fingers in there, once you have your hand down on the table, notice your arm can relax quite a bit more. I'm going to use my fingers to pop up to create the pressure. I'm going to use my stance to create a cross fiber. This is a cross fiber at the insertion of levator scapula. So the next set of moves, or rather the next move that we're going to be doing is going to be a cross fiber. We're going to do a broad, generalized cross fiber. We're going to use a bar of our fingers. So remember, when we create that bar, this whole surface is going to touch at the same time, or at least a large amount of it. Try to avoid doing this. This kind of creates a very narrow point of contact, and it's good for treating like one muscle or a certain spot. But when we want to catch a big area, we don't want to use a pointed tool. We want to use a flat tool that can catch a lot. So I'm going to use this bar. And what we're going to do is we're going to cross fiber 1/2 of the back of the neck all at once. The muscles we're going to get here are going to be splenius capitis, we're going to get trapezius, and we're probably going to get just a little bit of levator scapula at the same time. So I'm going to stand on the same side of the table that I'm working on. I'm going to go ahead and create a bow stance that looks across the table. I'm going to create my bar with my hand, and I'm going to go ahead and slide it behind the head. I'm going to start just basically right at the occipital ridge, almost where it doesn't feel like there's a lot of tissue, almost like it's more bony. My second hand oftentimes will just create a very soft grasp, so that way as I do the cross fiber, the head's not wobbling all around. It can create a little more stability. And just notice again, my elbow's not doing the work here, my stance is doing the work. So I'm keeping my fingers barred, a very broad cross fiber, and I'm going to work my way down the neck. Once I've worked on the occipital ridge, I'm going to step my way down one step at a time, all the way down, until I'm basically behind the neck. You see here I've brought my elbow in now that I'm in this different spot to create a cross fiber with a little bit more pressure close to the superior angle of the scapula, right about where the insertion of levator scapula is. Okay. Once I've done that on one side, I can do it on the other. The next move in the progression of the recipe is going to be the grasping of sternocleidomastoid. Now, classically for this one, I might kneel, but you might also use a seat to sit down on. So I'm going to make sure that when we use a seat, you want to remember to use good mechanics when you're in a seat. It's really easy to have bad mechanics sitting down. So the first thing you want to remember is as I sit into my seat, you are never going to use the seat back. You're not going to be even close to it. You're going to sit on the edge of the seat, and you want to stagger your feet kind of like you're in a bow stance. So now that I've brought my chair up, I'm on the edge of the seat, my feet are staggered kind of like I'm in a bow stance. Now we're ready to work on sternocleidomastoid. So a lot of times for me, I personally like to set one of my hands behind the client's head, and what this does is it kind of gives me a feel of connection, and it also gives me a little bit of control in case I do need to move their head for this one. So I'll usually lift and set their head in my palm. Now my second hand is going to create the shape where I'm going to kind of hook one of my pointer finger here, and I'm going to think about kind of scooping underneath the muscle and using my thumb to lock onto it. So here I am, I'm going to approach the sternocleidomastoid in 3 places for this move. One's going to be by the collarbone, one's going to be in the belly of the muscle in the middle, and one's going to be close to the mastoid process just behind the ear. So starting down at the collarbone, I'm going to scoop and use my thumb to pull and lock that tissue onto my finger. And once I'm here, I'm going to do 4 movements you can think about doing. The first movement is just rubbing the fingers together like this. The next movement is taking the muscles and stretching them lightly across the neck. I'm exaggerating, you're never going to move them that far. One stretch is going to move them back towards the table, and the last stretch is going to pull them directly away from the neck. So each place we touch, we're going to do these 4 movements. Here we are at the collarbone. We're going to grasp, we're going to do finger rubbing, looking for any ropey spots that we might be able to kind of work down into less ropey. Then I'm going to stretch across the neck, light movements. I'm going to stretch down back towards the table, light movements, and then I'm going to stretch directly away from the neck, light movements. When you're touching SCM, especially for your first time, it can feel kind of stressful, like you might hurt the client pretty easily, but in truth, it's actually pretty generous. You can grasp the sternocleidomastoid with a fair amount of power as long as you're gentle. You don't just go in there, surprise them with a quick grab. So now I'm in the belly, I'm in the middle of SCM. I'm going to do my finger rub, pushing the fingers back and forth on each other. I'm going to do 3 stretches. I'm going to stretch across the neck. I'm going to stretch down towards the table. And I'm going to stretch directly away from the neck. You'll notice that sometimes my grasp slips a little bit and I just grab it right back again. Okay, and then our third grasp is going to be towards the mastoid process. If it feels like it's stuck down, just do the best that you can to kind of grasp and lift it. And we're going to start by rubbing the fingers back and forth. And then we're going to do our 3 stretches. One stretch goes lightly towards across the neck. One stretch goes down towards the table. And one stretch goes directly away from the neck. Light lifting. Great. And having done that, we basically treated the SCM on the first side. We would just repeat that for the second side. Okay, so the next thing we're working on is going to be the scalene muscles. Now these muscles also originate on the cervical vertebrae between C2 and C7. They come off the transverse processes similar to the levator scapula. Now when we think about the transverse processes, the levator scapula is just barely on the posterior side of it, but the scalenes are just on the anterior side of it. So I'm going to go ahead, sorry about that, we're going to go ahead and lightly, you don't have to, but again I like to set the client's head in my palm to kind of connect and have good control of the head. We're going to feel for the shallow spot where the transverse processes are. I'm going to start low in the neck. This is much easier to find the scalenes. So I'm going to find the spot where the transverse is poking out. Once I find it, I'm going to go ahead and come off of it. I'm going to shift my pressure anterior. I'm going to push it medial, and then I'm going to pull back down towards the table. At this point, you should feel kind of like you're pushing into a taut sheet. There's the muscle here. This is the scalene. We're not going to differentiate the scalenes. We're just going to think about them as a group today. So once I've contacted by pulling down towards the table onto the scalene, I'm going to try to, as much as I can, create a bow stance in my seat, and I'm going to use my body to create a light cross fiber in the scalenes here. Now, like we mentioned, the scalenes go all the way up to C2. As we continue to move our hand up towards the higher or up towards the skull, the scalenes are going to narrow like a triangle up till the very point. So even though it's very broad at the lower part of the neck, it becomes much more pointy and skinny as you approach the upper neck. So you'll have to use more and more of kind of like almost your fingertips to stay on there. And again, as you get to C2, even with your fingertips, it's going to feel like walking a tightrope. It's very skinny. It's easy to slip off. All right. So once we've cross-fibered the scalene muscles, the next thing that we're going to do is a cervical rock. Now in this move, we're actually going to be doing, it's similar to when we did the cervical push side to side, but instead of going left and right, what we're going to do is we're going to push them up towards the ceiling, and then we're going to let them fall back down towards the table. We're going to do this move on C7 all the way up to C1, one at a time. The first phase involves lifting the spine up. We want to think about it more like a stretch. We don't want to jerk them into that move or bounce them into the stretch. When we're done with the stretch, we're going to let it fall. Then we're going to bring our hands back up to the occiput, and we're going to create a light traction to let the vertebrae have the space to fall back onto the table. So here I am. I'm bringing my hands underneath the C7. I'm going to start just wide of the spinous process, and I'm going to lift. My hands are on the table. My fingers are lifting like they're beckoning. And I'm going to hold it like a stretch. I'm going to give their body time to change and kind of stretch into this movement. Once I feel like they've shifted, I'm going to let my pressure fall away. I'm going to shift my hands up. I'm going to grasp lightly at the occiput. I'm going to give them a light traction. Then I'm going to go to C6, and I'm going to lift. And I'm going to treat it like a stretch. I'm going to give them time, let their body shift and change into the stretch. When I'm ready, I'm going to let them fall back down, slide my hands up, light traction of the occiput. And then I'm going to go down to C5. And I'm going to do the same thing again. Lifting towards the ceiling, creating a light stretch. Letting them fall, light traction. C4, same thing, light traction. C3, lift. and traction and fall. C2, you're almost at the occiput at this point. And C1 is almost always buried under that thick fascia. It's almost like just compressing the subocciput. And then lightly tractioning, that'll end the cervical rock. The next thing that we're going to do is a series of passive movements and stretches for the head and the neck. When we do passive movements of the head, I recommend that you lightly grasp behind the head. You want to kind of circle your fingers behind the ears, and a lot of times I'll use my thumbs to lock in, not at the temples, but behind the temples. This gives us a good control without feeling like we're pushing on the client's face. So now what I'm going to do is I'm going to start by doing a passive movement of a rotation. We're going to turn the head lightly to one side, and then lightly to the other. Notice that I'm not rolling their head on the table. Their neck is staying right in the center. As an example of what we don't really want to do is we don't want to do the roll like this. Notice how I'm letting their head roll on the table. Notice how their neck is bending from side to side. By lifting the neck and then rotating, the spine stays right in the center. Okay, the next passive movement we're going to do is ear to shoulder. It's a head tilt, so we're going to go ahead and take them ear to shoulder and ear to shoulder. We don't have to think of these as stretches. We're just tracing their movements. When we get to the edge of their range of motion, we just gently hold it and then we come back away. We don't actually have to do a deep stretch yet. Okay, so we've done our head tilts. Our last movement is going to be chin arcs. I like to stand for this one. We're going to turn the head, lift it, and we're going to trace their collarbone with their chin, turning around in an arc, coming out, bringing them back in, tracing the collarbone with the chin, and coming back up. So we've done our 3 passive movements. We're ready for our 3 stretches now. So for the first stretch, we're going to go ahead and think of this as a scalene stretch. So to make it as simple as possible, we're just going to go ear to shoulder again. So I'm going to go ahead and take her down to her left, lightly bring in the ear towards the shoulder. I'm going to ask the client to let me know when they have a light stretch in this area right here in the scalenes. How are we doing?
Good.
Okay. And once they're there, we're just going to hold this stretch and allow them to take the stretch in. Remind the client to keep breathing. Remember that the stretch should be let in. More intensity is not necessarily better. If you see the shoulder popping up, you can use your second hand to lightly keep the shoulder down. But again, you don't have to like jam it down. It's just kind of a coaching reminder for them. Once you've done that on the first side, do it on the second. The second stretch we're going to do is going to be for Sternocleidomastoid or SCM. For this stretch, what we're going to do is we're going to rotate the head. So I'm going to take the head and I'm going to go ahead and rotate it. And basically what I'm going to do is I'm going to use my hand lightly behind the head, my thumb just behind the temple to create just a little overpressure on the rotation. I can use my second hand to just lightly keep the shoulder down and relaxed. And again, we can check in. How's our pressure?
Good.
All right, cool. So again, we can just hold this stretch, allowing them to take it in. As a reminder, while we're holding the stretch, even though the client's rotated to the left, it's actually the left side SCM that's getting the stretch here, not the right side. Okay, once we're done with that, we can do the stretch on the second side as well. And the last stretch that we're going to do here is going to be a stretch for the upper trapezius. So in this case, what I'm going to do is I'm going to go ahead and stand up again. I'm going to take a nice broad stance. I'm going to go ahead and take the head forward, and I'm going to slide my arm underneath. My forearm is going to rest underneath their occiput. My hand is going to rest over the shoulder. Then I'm going to take my second arm. I'm going to create an X shape behind the head. My hands are on the shoulders. I'm going to lift my forearms up as I gently keep the shoulders down. And again, we're just looking for the light sensation of a stretch. It doesn't have to be very intense to be effective. How are we doing? All right, so we're good. We're going to hold this stretch, reminding the client to breathe, allowing the stretch in, and when we're ready, we can gently let the client back out. Okay, so we've done our 3 stretches. Last thing that we're going to do is going to be our 1 circulatory stroke for this recipe. So in this case, usually what I'll do is I'll take just a teeny bit of lotion or a little bit of oil, and I'll just coat my hands. This stroke is going to be a knuckling stroke. So I'm going to use one hand to lightly gesture the back of the neck open. I'm going to go ahead and sit forward at the edge of my chair. I'm going to turn my knuckles in, and I'm going to stroke from the mastoid process down to the acromion. And just a few strokes like this. In truth, your client probably has the patience for this to happen a dozen times, so don't feel like you have to do this 4 times and then get out. You can usually do this for quite a while. Great. And when you're done, that's going to be it for this particular recipe. Just make sure that you've done all the moves on both sides of the neck, and I'll see you in class next time.